we know all healthcare starts with vascular access. At the end of the day, when you go into a doctor's office or a hospital and need medical care, you need vascular access, whether for infusions, fluids, antibiotics, saline. Everything starts with vascular access, and that's where we fit in. And we treat it as a high-level clinical procedure and skill set, for which it is.
When customers come to us, they are really looking to solve 2 or 3 problems. Okay, they are either looking to solve a problem of coverage. It's been too hard for them to be able to get enough hours of coverage of this type of vascular access services. Or they're looking to solve a problem associated with cost on their side due to either high turnover in their staff or due to the placement of some of these lines in an interventional radiology suite. And they approach us so that they can solve those kinds of problems.
Mobile does not mean lower quality. Mobile means, to me, and mobile means that, yes, Vascular Wellness is mobile. They will come when you need them. You don't have a team of 35 full-time employees sitting, on a day where you may have, not very many procedures to do. You call us when you need us. There's no overhead. You don't have to find other things for our nurses to do. Again, on demand. If you don't call us, there's no charge associated. So if you had a slow day and you had a patient load that didn't need vascular access attention, then the hospital is having a better day as far as budget.
Early onset of the correct vascular access device leads to a reduction in length of stay. I mean, I don't think that's even questioned now. There's a lot of regulatory agencies that want to know, how quickly did you give that first antibiotic? At what point from time of admission to the time of the first antibiotic? That's a important benchmark that hospitals have to meet. And in this day and age where the patient's vascular condition is very compromised, years ago, there was maybe 10 or 20 routine IV medications that we gave in the hospital. Now there's more than 500. So over 95% of all patients need a vascular access device. And the ability of nurses across the country to be able to provide that device has not increased, it's decreased.
At first glance, hospital finance departments can see us as kind of expensive, but when they look at the whole picture, okay, we don't have to order supplies anymore. We have purchasing power because we purchase so many supplies. We tend to get them at a very good rate. So the supply management piece is taken out. Expiration. I mean, people don't think about, we have converted hospitals before that found, thousands of dollars worth of expired product in their central supply. And that's just money basically, lit on fire. So a tighter supply management piece, because they're not managing it. We're bringing it in. As far as capital equipment, those are large purchases. Ultrasounds can cost a lot of money, and then maintaining them. The warranty is good for a year, and if you break it, you've pretty much bought it. And if it's bad enough, you have to buy a new one. So all of that burden is taken out of the hospital.
As vascular access specialists, of course, we provide more than just procedures for the hospital. As any nurse can tell you, when you're dealing with central lines or midlines, there's always troubleshooting needed. We actually provide troubleshooting tips free of charge to our clients, which eliminates many times the need for them to call us and come and actually have a clinical visit. Sometimes those things are easily solved by phone. I've been called to call a nurse and I'll say, try this, try that, which is great because the nurse can take care of the problem themselves and they don't receive a charge from us. Those are services we provide to all our clients. To provide that patient the best line the first time is really helpful, not to the patient, not only to the patient, but to the facility. There's not unnecessary procedures. The cost is reduced. And if you can do that in a really careful, pristine manner, you're also going to cut down on catheter-related bloodstream infection, and also reduce other sequelae of catheter insertion like DVTs. All that can be reduced with careful training and having people that have done the procedure literally hundreds of, even thousands of times, you get that skill set. And it's the same as anything else. If someone's doing a heart surgery, you want someone that's done it 1,000 times, not 5 times. It's no different in vascular access. You want a really skilled clinician to be able to do those procedures for you.